من تحت. معلش نبتدي للبيجنرز خالص خالص ان احنا نبتدي نقول البون ستراكشر بتاعنا، ايه البونز بتاعت الوش، عشان واحنا بنحقن او الزملاء ان شاء الله لما يجوا يحقنوا هيتكلموا على اسم البون معتقدين انه كله هيكون مستوعب. احنا عندنا الفرونتال بون، عندنا النيزل بون، عندنا الزيجوماتيك بون، عندنا الماكسيلا، وعندنا المانديبل. ده البون ستراكشر. وفي شويه التيرمز اللي موجوده واحنا بنحقن ان احنا بنتكلم في وات از كولد سوبرا اوربيتال مارجن اللي فوق، عندي اللاترال اوربيتال مارجن بتاعت الاوربت هي اللي بره دي، عندي الانفرا اوربيتال مارجن، عندي الزيجوماتيك ارش، عندي في المانديبل عندي الريمس اوف ذا مانديبل اللي هي بالطول، البودي اوف ذا مانديبل اللي هي بالعرض، وعندي الانجل اوف ذا مانديبل. طيب البونز دي اللي احنا قلنا عليها هو كده لازقين في بعض، هي كتله واحده واحنا مسميينها كده؟ لا، دي عباره عن بونز لوحدها خالص بتلزق بعضيها في بعض عن طريق سوتشرز. دي اسامي السوتشرز بتاعتنا اللي هتلاقوها بتجمع كل اتنين بون مع الثانيه في الوصله بتاعتها. دي الوصله اللي هو فرونتو زيجوماتيك، زيجوماتيك تمبورال سوتشر، زيجوماتو ماكسيلاري سوتشر، وفرونتو نيزل سوتشر. لو خدت بالكم هي واخده الاسم بتاع البون دي والبون الثانيه، كل اتنين بون لو عرفتوا اسامي البونز هتقولوا السوتشر دي مثلا دي عباره عن الفرونتو نيزل بين الفرونتال بون والنيزل بون، فتسمت فرونتو نيزل سوتشر. يبقى دي الخطوط اللي هي زي البازل، ربنا خلق الجمجمه دي زي البازل ماسكه في بعضيها عن طريق السوتشرز دي. السوتشرز دي هيبقى لها اهميه يس. طيب كده اتكلمنا على البون، نتكلم على الفات كومبارتمنت. كان زمان كنا بنتكلم في حاجه اسمها الفات او السوبرفيشال فات، كانت كلمه عامه جدا لغايه ما ابتدوا يمكن من 2007 كان اول حد اتكلم عليها واحد اسمه روريتش. روريتش ده هو الاديتور بتاع البلاستيك اند ريكونستراكتيف سيرجري. اوكي، مين عايز بيور انجلش او ميكست انجلش وعربي؟ بيور انجلش، حد عايز بيور انجلش؟ طب مش تقولوا ده احنا هنبتدي من الاول تاني. طيب اوكي، يبقى نخليها انجلش. الفيس كومبارتمنت، الفيس كومبارتمنت means ان the face of the الموجود في الفيس is divided into several compartments into rooms صغيره. السيباريشن بتاعها زي ما هنشوف عباره عن ligaments. These ligaments separate these fat او superficial او دي fat into small chambers or rooms. طيب this is the cross section, and always when we inject, as I said before, we either inject superficial level or we inject in a deep level. So we say always we inject superficial fat or you inject the deep fat. There is no other level we can inject. We don't inject filler intradermal unless it is in very special conditions where we need intradermal injection of very small fixed lines. We can do it intradermal. Otherwise, the pure filler always injected at a superficial level or at the deep level. This is the idea of fat compartments. As I said before, we have ligaments. These ligaments, the main ligaments are called true ligaments. It's like a tree. The main trunk starts from the bone. When it goes up, it is divided into small tree branches. So simply when the ligaments start from the bone here, from the periosteum, it is called the ligament. So it divides the deep fat into small compartments called the deep fat compartments. When it bypasses this mast layer or the muscular layer, it is divided into small branches. These small branches are divided by what is called septum. So always the ligaments start at the bone. And at this mass, it changes the name from ligament to septum. The ligament divides the deep fat, and the septum divides the superficial fat into small compartments. This is the idea how these compartments, or from where the origin is of these fat compartments. These are the ligaments of the face. We have what is called true ligaments, which come from the bone to the dermis. And we have what's called false ligaments, which start from the fascia or the mass layer to the skin. It doesn't start from the bone. It starts at a higher level. So simply, the true ligament is the main ligament. We have zygomatic ligament and we have the mandibular ligament, which are the main ligaments of the face and the most important ligament because they are true ligaments starting from the bone to the skin. Then we have these others, and this is more advanced. This is only the picture. Please take it for all the true and false ligaments of the face. So, what I mean now that we have borders. These borders are created by different structure, mainly the ligaments, and separate the deep structures or the deep fat into small compartments. So what are the deep borders of the face here? We have zygomatic ligament, orbital retaining ligament. We have preauricular, parotid masseteric ligament. We have the facial vein and the facial artery. So these are the main borders at the deeper level. When I talk about deeper level, I'm expecting in these ligaments will separate the facial structure of the fat into small compartments. So simply, between all this area, we have the deep fat compartments. Okay? So now, these ligaments, when it moves up into the layers of the skin, it changes the name from ligament to septum. So if you can see, this is the same landmarks, but the name is different. So for example, when you're talking about zygomatic ligament, this is not no more zygomatic ligament because we are above this mass layer. So now it's called superior cheek septum, and so on. So we have main trunk till this mass layer, branches into septi, and then we have the skin. Deeper, we have the deep fat compartments. At superficial level, the septi divided the fat into superficial fat compartments. So in each area almost, we have a deep fat compartment at a deeper level, and then when we go upward, we have superficial fat compartments. And this was the idea of what's called face map. The face map is fat compartment aesthetic map. What is the rationale behind? These lines are simply the same landmarks of the deeper structure or the deep borders of the face and superficial border of the face because they are the same. As I said, we have the deep ligament, and then we have at the same level, it will be superficial septum. So when I draw up these landmarks into very clear lines, we can draw it on the face of the patient. So in between these areas, we have the superficial fat divided into different compartments. And between the same borders, we don't have to change lines. They are the same borders. We have also now the deep fat compartment of the face. This was the idea of the face map. Through the face map, and this is more advanced level, but as the face map, you can make your approach, your concept. You are not obliged to do something different. I cannot say this is the best way for lifting or augmentation. Also, it's up to you. It's up to you, to your concept in injection. But through the face map, we can just, for myself, if I want to lift, so I have to inject these compartments. And I have to decide, do I have to inject it deep only or deep and superficial? If you want a better lifting, I just have to inject the lateral compartments. If I want to inject better, I have to go down to make a lifting for the lower face. This red square, it's a middle fat compartment, superficial compartment. The problem is this compartment is a little bit dynamic. This is what we will explain later. So through this face map, you can put your own design, your own plan, your own concept. But when you use it, you will use less material, you are anatomically in the correct position,